Hello everyone and welcome back to the YouTube channel. If you're here for the first time, hi, my name is Busari Molayo and I'm a registered nurse. On this channel, I'll film content related to nursing and healthcare, and in today's video, I am going to be talking about 3 major career paths in nursing science. So if you're a nursing student or you're about to graduate or you just gained admission into nursing school, this video is definitely for you. Under each career path, I'm going to introduce you into the career, like the qualifications you need to get started, as well as the pros and cons of each of these career paths. So let's get started. Alright, so the first career path I'm going to be talking about today is clinical nursing, which is actually the most popular career path in nursing, and that basically means nursing within or related to the hospital. Actually, a layman will move into the hospital and see nurses dressing wound, attending to patients, doing bed baths, and all sorts of procedures that we do, and just think that nursing doesn't go beyond that. But if you take a deeper look into this career path, you understand that clinical nursing is actually very broad. For example, there are several specialties in clinical nursing. You have specialties like psychiatric nursing, midwifery, that is even in Nigeria anyway. There are several other specialties in some other countries and continents, but for my country, the popular ones are, just like I said, psychiatric nursing, midwifery, perioperative nursing, orthopedic nursing, there's emergency accident and emergency nursing, there's pediatric nursing, I believe, I know of ophthalmic nursing, I know of what's it called, there's this occupational health nursing, which is, I don't think it's quite popular, but then it's actually a lucrative aspect of clinical nursing. So what are the qualifications that you will need to get started in this particular career path? Ideally, all you need is your registered nursing license, RN, that is a diploma in nursing. Once you have a diploma in nursing, then you are good to get started in clinical nursing. I hope you get. So the minimum qualification is RN. Now, coming to the pros and cons of this particular career path, I believe this is the easiest career path to get a job, like a government job, because there are so many government privately owned hospitals around that are willing to employ. However, the pay, for example, in my country, the pay actually varies and is affected by the economy of the country, but that does not mean you will not get a job at all. The pay may just not be as lucrative or as much as you expect, but yeah, you would always get a job with clinical nursing. And there are several hospitals that require certain specialties. So in this kind of hospitals, you would have to get an extra qualification aside your basic RN license. So you can get an extra qualification like psychiatric nursing, midwifery, public health nursing, accidents and emergency nursing. Like you have to do like a post it's called, what's it called? It's called post basic nursing courses. They are called post basic nursing courses, sorry, and there are particular post basic nursing schools for these particular nursing specialties. Do you get? Now, a disadvantage that could come with clinical nursing is that the health risks are very high, in the sense that you come in contact with several patients with different infections. Most of these infections are communicable. In other words, they can be passed from one person to another. So imagine you attending to people with diseases like hepatitis, or you have to touch blood samples or body fluids from people that have HIV, AIDS, and all of that. However, you are going to be trained to maintain standard precautions, but the risks are still very high. Sometimes you may not even know the infection the patient has. Maybe it is you can contact it through contact, or let's say from inhaling aerosols from that particular person. So you can't exactly tell until the test has been done. So the health risk in this particular career path is very high. And yeah, that's about clinical nursing. The second career path I'm going to be talking about, of course, is academic nursing. Yes, some people have to train nurses even if they're going to end up in clinical nursing, which is the most popular or the most common career path. But there are some people who have their sole purpose or their sole job is to keep training nurses to make sure that there are always nurses available. You know, definitely some people are going to grow old, retire, leave the hospital or clinical setting, and we must have nurses who are fresh nurses who are coming to replace these people. So when it comes to academic nursing, there are different cadres or different stratas or different qualifications that you would need to get to certain levels in academic nursing. Now, for my country, which is Nigeria, if you're going to be a lecturer in a school of nursing, you need to have either of these two things minimum. One, you need to have a registered nursing tutor degree, meaning that after your possibly after your RN, which is your basic nursing qualification, you need to go for a post-basic course in education that will qualify you as a registered nursing tutor. That is what I know to be the ideal route for becoming a nursing tutor with a diploma in nursing. That's the extra certificate you need to get. Another thing you can do is to get a bachelor's degree in nursing science. So if you're going to be a lecturer in a school of nursing, you need to have like either a RNC degree or a bachelor's of nursing science, which qualifies you to be able to teach those in school of nursing. Now, if you're coming to the university setting, if you have a bachelor's degree in nursing science, you are going to be at the lowest cadre, which is the cadre of a clinical instructor. Now, that instruction rooms of different schools, and you're going to be basically teaching students practical skills. That is for bachelor's of nursing science. But if you want to become a lecturer in a university, you need a minimum of a master's degree. So not masters in public health, because I believe I've seen a number of tutors who have masters in public health but were placed as clinical instructors and not lecturers. So it is specifically masters in nursing science that would qualify you as a lecturer in a university, in a department of nursing science in university. Basically, you can also have the PhD. You also have the PhD holders and the professors who these are more like advanced levels or advanced degree holders when it comes to academic nursing. But I hope you get the difference. Now, in school of nursing, you should at least have a registered nursing tutor degree combined with your registered nursing diploma, or you have a bachelor's degree before they can take you as a tutor. While in the university, a bachelor's of nursing science would be at the level of the clinical instructor, while a master's in nursing science could start as a lecturer. Do you get my point? So that is that about academic. Now to the pros and cons of this particular career path. Now, with academic nursing, the employment opportunities are not as numerous as that of clinical nursing, because for a school, let's say for a particular university, you may only have like a total of 20 to 30 lecturers in a nursing department. But in the hospital, 20 to 30, except it's a very, very small clinic, that a total of 20 to 30 nursing personnel will be enough. In a tertiary institution, tertiary hospital, in a ward, you may need up to like 12 to 15 nurses to run shifts conveniently. Like if you don't want to suffer from short staffing, staff burnout, and all those kind of things, you would need at least like 12 to 15 nurses to run a single ward. And a tertiary institution would definitely have several wards. You're going to have wards like A&E ward, maternity ward, obs and gynae ward. You're going to have female ward, male ward, children ward, and so many psychiatric ward, and so many other things. So when it comes to academic nurses, the employment opportunities are not as numerous as compared to clinical nursing. I hope you get my point. So now to the third and final step, or the third and final career path. But just before I move into that, if you've not subscribed to my channel, please click on the subscribe button below to join the YouTube family, and also click on the bell icon so that whenever I post a new video, you're going to get a notification on your phone and you're going to be the first to know. All right, now let's go to the third and final career path in nursing science. Now, the third and final career path that I'm going to be talking about today is not something that is quite popular. Honestly, it is the least popular route that nurses tend to consider as a career path, and that is entrepreneurship. Now, entrepreneurship is quite broad, and thanks to social media, internet, and all computer devices that we have at our disposal in this time and age, entrepreneurship is much easier than it was. Is easier than it was in times past. Let's say like in the 1900s, the major entrepreneurship opportunities for nurses is either, let's say, a private practice. That's like when you go to do home service for private patients, or having a clinic. Like private practice was the major entrepreneurship opportunity available to nurses. during the 1900s. But now we have several entrepreneurship opportunities for nurses. Number one, you have freelancing. Freelancing, which I do, involves you just basically using your skills. Like, you don't exactly work under an organization. You decide what you want to do with your skills. Possibly you're good with writing, let's say healthcare papers, and you start taking jobs from companies, brands that need those kind of services. Because you have experience and you have the certification, you take jobs or take gigs from them, you write papers for them, and they pay you. Freelancing is one good entrepreneurship option for nurses. Number two, you have social media influencing. This is still quite new, but nurses are beginning to understand that they can come on social media and be healthcare influencers. Yes, you have a lot of them now, even though we are still staggering and trying to understand how to do this properly and still maintain professional ethics. But that doesn't mean that this opportunity does not exist, and there are several people both home and abroad, I mean both in Nigeria and Nigerians are abroad, that are doing this. You're sharing opportunities like traveling out, sharing let's say memes about things that you can do about nursing, making people enjoy or see another aspect of nursing, and they're making quite a lot of money from it. YouTube, like content creation, which falls under like this social media influencing part. Though an influencer and a content creator are different, but I won't really be diving into that into this video. But content creation is actually another good entrepreneurship option for nurses. Personally, I'm a content creator. Like, you're watching me on YouTube right now, and YouTube is one of the social media platforms that allows you to make money while putting content on their platform. So you're going to be seeing on YouTube now, a lot of nurses are coming on YouTube showing their lifestyle, teaching people, like online tutoring, which also still falls under entrepreneurship. So when it comes to entrepreneurship, the options are diverse. You can still choose to take the traditional route of home service or domiciliary nursing or domiciliary midwifery, or go open your own personal clinic, or you start doing online consults, making sure that you're still upholding professional ethical standards. And just like I said, there's content creation, and at some point some brands who have products or services related or specific to nursing students or nurses may begin to sign you as brand ambassadors. So entrepreneurship is also a good career path to consider as a nurse. Maybe in some of my subsequent videos I will really take this entrepreneurship career path for nursing and discuss it, like, and break it down into pieces, because right now the more I'm talking about it, the more I'm figuring out that there are so many things that I have to say under this topic. But yeah, now let's quickly discuss the pros and cons of this third and final option. The major advantage of entrepreneurship as a career path in nursing is that you get to control when you work, how you work, and how much you earn. Unlike the initial two that I spoke about, where the organization or the government you're working with gets to decide your monthly salary or your monthly pay. For entrepreneurship, the more work you put in, the more money you are likely to make. However, this will be influenced with things like, let's say, foreign exchange, things like the economy of your country, and different things like that. But it is very, 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 very flexible when compared to the initial two that I mentioned. So flexibility is an advantage. Being able to determine when you work, how much you work, and all of that is also an advantage. Number two, another advantage that comes with entrepreneurship is that it can be combined with the initial two. So you can be working in hospital and use your off days to, do something aside the hospital. So you can also be a lecturer and use your maybe the holidays or times where you not actively be working in the school to do something else. So that is one other advantage with entrepreneurship. It can be combined with the initial two. However, I know you can combine academic nursing with clinical nursing, but the fact that these two career options are not so flexible may make it quite difficult to merge it without so much stress, unlike when compared to merging entrepreneurship with either of those initial two. Despite the fact that this career path is very flexible, there are still some risks involved. For example, if you're doing home service, you could run into security issues on your way, or maybe at the place of your client, you run into some ethical dilemmas, and that is a risk you may not experience in the initial two career options that I mentioned. Number two is that you are going to need to invest a lot of time, energy, and money into your entrepreneurship aspect or area that you've chosen. and before you start earning, it may take a while. The entrepreneurship option can be quite draining as well, depending on which aspect you've chosen. Do you get? And you may have, it may also require that you have to start learning extra skills outside nursing, like marketing, production. For example, I'm a content creator, so I had to learn content creation separately from nursing, even though the content I wanted to create was nursing, which I already had much knowledge on. But I had to learn content creation, learning about social media algorithms and all those kind of things separately aside from my nursing knowledge. So those are some of the pros and cons. I hope you guys get what I'm trying to say. Now, if you enjoyed this video, please give it a thumbs up. If you want to see other videos where I talked about issues related to nursing, just click on this playlist that is going to pop up here on the screen now, and you see all my videos where I discuss things about nursing. And with that being said, I'll see you in my next video. Bye.